Assalamualaikum doctors. In this video I am discussing a video station that is about Staphylococcal scalded skin syndrome, SSS. So how the description will be, I can see irritable neonate or child it can be, but don't appear overall unwell. There is macular erythema and marked by epidermal exfoliation of the skin, peeling mainly in the right arm, that is our is left arm, and periumbilical perianal area. So what is the description? Description is that irritable child or neonate appear overall unwell, but there is macular erythema, marked exfoliation and peeling of the skin. So the description is macular erythema and marked epidermal exfoliation and skin peeling, mainly in the arm, periumbilical and perianal area. So any area can be it develop. What are the DD we ask for SSSS? It is caused by exfoliative toxin of Staphylococcus aureus. The DD of SSSS are epidermolysis bullosa, Stevens-Johnson syndrome, toxic epidermal necrosis, burn, eczema. So toxic epidermal necrosis, epidermolysis bullosa, Stevens-Johnson syndrome, eczema, allergy. History are OCD, what increase and what decrease, associated with fever. If yes, which start fast, and distribution and sequence of the rash. Any desquamation, facial erythema, rash is painful with scales, rash is flexors area. Any affection and numbers. Okay, mucosa. Any mucosa affection and numbers, his feeding and number of nappies per day. So here dehydration status is very important. Family history of similar condition, fever, weight, activity, sleep, eye, mouth, lymph node enlargement, joint, vaccination status, history of drug intake, COVID vaccination and exposure, history of travel, history of preceded upper respiratory tract infections, history of any chronic condition, allergy, exposure to COVID. So this is the history we ask, age of the patient, generally affected, children under age of 5 years, remember particularly neonate, history of fever, irritability, family history of epidermolysis bullosa. Okay, so history of Staphylococcal scalded skin syndrome is that OCD increase decrease, rash, its distributions, rash exfoliations, any mucosa involvement or not, dehydration status we ask, like number of nappy, feeding history, rash is exfoliated, Nikolsky's sign we ask. The child is irritable, fever, weight, activity, sleep, any chronic conditions, family history, exposure to COVID. Other are like lymph node enlargement, joint, vaccination status. These are we are asking. And examination we do ABC vital, citation status, examination of the rash and Nikolsky sign, and examination of the eye, mucosa, lymph nodes, neurological examinations. Investigation is a positive Nikolsky sign with red skin below it, skin punch biopsy to show the desquamation of the skin with separation dermo-epidermal junction at the level of stratum granulosum. Nasal swab not from the skin as it's sterile. Septic workup and inflammatory marker and wound care. Management is admissions, ABC, check the hydration status plus wound care, and IV flucloxacillin. Remember, IV flucloxacillin is the treatment of SSSS. Multidisciplinary team is consultant, dermatology, microbiology, wound team, physiotherapy if contracture. Complication is dehydration, skin pigmentation, sepsis with secondary bacterial infection, cellulitis, scarring, contracture, and mortality is 4%. Okay. Is different is toxic epidermal and Stevens-Johnson syndrome is that toxic epidermal necrosis is 30% of the body affected and high mortality. It is toxic, remember, look toxic. Stevens-Johnson syndrome, it is usually come with history of 2 to 4 weeks treatment with epidermatitis with involved 10% body. Okay. And SSS, it is less than 2 millimeter, maybe 1 or no. Macular erythema with scales, painful, common in flexors area, fever with facial erythema, mortality 4%. So I am telling Staphylococcal scalded skin syndrome. I can see a child who is irritable, probably neonate, less than 5 years age old child must be neonate. They have some skin, these are desquamation of the skin, peeling of the skin, irritable, erythema present. So putting together, I think on top my SSSS, second are it can be Stevens-Johnson syndrome, toxic epidermal necrolysis, epidermolysis bullosa, eczema, drug reactions, allergy. These are I am keeping, burn. So OCD, increase, decrease, the rash distribution, desquamations, blanching or not, Nikolsky sign positive or not, mucosa involvement or not, feeding history, dehydration history, vaccination history, any drug intake history, family similar conditions, these are we ask. Examination we do ABC vitals, then we do Nikolsky sign, abdomen examination, skin examinations, any lymph node examinations. These are investigation. We do the septic workup, full blood count, ESR-CRP, and the child is Nikolsky sign. That is very important. Investigations. Skin punch biopsy. Okay, in skin punch biopsy, nasal swab. These are management, ABC, vitals, hydration status maintained, and the flucloxacillin is the treatment. IV flucloxacillin. And the multidisciplinary team, my pediatrician, a dermatologist, and microbiology, own team, physiotherapy, contracture. Complication is sepsis, secondary active infections, dehydration, very important, skin pigmentation, contracture. These are cellulitis sometimes develop, secondary bacterial infections. So this is SSSS video station, which is caused by exfoliative toxin of Staphylococcus aureus. Thank you.